Well, now we're going to hear from a patient and a psychiatrist on the realities of treatment-resistant depression during Mental Health Month. So let's welcome Dr. Lisa Harding, board-certified psychiatrist and medical director at Depression MD, and Mark, a 55-year-old patient living with treatment-resistant depression. So first of all, thank you both so much for joining us today on this a very important topic.
Thank you for having us.
Thanks, Jordan. Thanks for having us.
Of course. So let's start with you, Dr. Harding. Can you tell us about the signs and symptoms of clinical depression and how common it actually is?
So there are about 280 million Americans living with depression, and about a third of them have what's called treatment-resistant depression. And that refers to any patient that has tried and not responded to 2 antidepressants at adequate dose and duration. So the definition of depression is really just for clinicians to sort of think through treatment steps. And so we have the major symptoms and we have the minor symptoms. And the major symptoms are the ones that I think most people identify with: the low mood, the inability to participate in life. And the minor symptoms are actually the ones that sometimes you don't think about that are signs and symptoms of depression. You can have the inability to concentrate, disturbances to sleep, changes in appetite. And for treatment-resistant depression, I'm really fortunate to be working with J&J because they have developed a new treatment for treatment-resistant depression called Spravato.
Yeah, so tell us a little bit about that, but also what exactly is treatment-resistant depression?
Yeah, so treatment-resistant depression refers to moderate to severe depression, and it's those patients who have cycled through many treatments. They've tried 2 antidepressants and not responded to either one of them. And Spravato is a nasal spray that is FDA approved, that has to be done in a treatment site that is certified to do the treatment. And those patients can access the treatment after they've been assessed and diagnosed with treatment-resistant depression by a clinician. As myself as a psychiatrist, they can get referred by their therapist or even their primary care doctor.
It's awesome that there's an option out there now. So Mark, can you tell us about your experience with treatment-resistant depression?
Yeah, sure thing, Jordan. First of all, I want to thank you for giving me this platform to share my story, and thank Johnson & Johnson for working with me and allowing me to reach others and show that there's hope out there. So for me, treatment affects everyone just a little bit differently. For me, treatment-resistant depression manifested as not only a depressed mood, but the inability to enjoy things in my life that I should enjoy, which would be social activities with friends and family, hobbies, things that we sometimes take for granted, but we enjoy doing. So treatment-resistant depression for me is the fact that I tried 5 different oral antidepressants over a period of about 15 years or so, and received little or no benefit, or some benefit that was offset by negative side effects that I just couldn't live with. So in short, that inability to feel joy really made life tough and made it tough to live through.
Can you walk us through your current treatment plan?
I've been taking Spravato for about 2 years now. When I started Spravato, you start with a treatment plan of 1 to 2 times per week. So I started out doing Spravato twice per week, and after that first week, I felt effects of it, positive effects. And what it did for me immediately was it gave me a more calm inner feeling. It allowed my thoughts to be more organized and not race so much and have so much, for lack of a better term, noise in my head. And just over the 2-year period, I've just incrementally gotten better as far as my mental health goes. So today, I'm sitting here before you. I'm someone who enjoys life again. I look forward to things that I enjoy, whether it's a hobby I enjoy or time with my friends and family. And life is more pleasurable now. So instead of going through life as a chore or something that I have to do every day, wake up, go to work, come home, rinse and repeat, I actually enjoy life. I look forward to things. I look forward to speaking to you and other people about my journey, and hopefully giving people exposure to this type of treatment that may help them also. There's more people out there like me than we can count. So I just hope this reaches someone and allows them to get the help that has helped me.
Well, I'm so glad to hear that you're doing well and that this has been able to help you. So Dr. Harding, where can folks find more information on this?
Jordan, folks first definitely need to see a clinician, a psychiatrist like myself, their primary care doctor, or as Mark was referred by his therapist. They can definitely do a safety assessment and see if they're appropriate for the treatment. But Spravato.com has a lot of information about the clinical trial as well as the important safety information. And it has the additional benefit of if you can go on there and you can put in your zip code, you can actually find a REMS certified treatment center where you can reach out and understand the process to be evaluated for the treatment.
That's wonderful. Well, thank you both so much for joining us today, Doctor, for that information, and you, Mark, for telling us your story.
Thank you for having us.
Thank you for having us and giving us this time.
Of course. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.